Yeah, thanks very much. The study was actually undertaken by Karen Briggs, and I just want to make sure she gets appropriate credit for the quality of the study and the quality of the information that we were able to achieve. So basically, so I'm a surgeon, so why would I want to use an arthritis brace? Well, the reason is that I think all of us in medicine would like to get the best result with the least treatment. And so if we can if we can do an operation and make a knee better, then that's one side. But if we can use a brace and get the patient better and improve their activity level, I think that's basically a better answer to their problem. So just to go through what has been talked about before, there's a tremendous cost associated with osteoarthritis. And the baby boomers, who I've just come from a meeting actually about baby boomers, but they're a large percent of the active population. And baby boomers just won't take no for an answer as far as exercise is concerned. Treatment protocols are important to help patients maintain activity. So malalignment, that means like a bow leg or a knock knee. This is a disability that's associated with our osteoarthritis. And the more out of alignment, the more pressure is placed on the joint. So the more bow-legged you are, the inner part of your joint gets more pressure. The more knock-kneed, the outer part of your joint gets more pressure. So the purpose of this study was to determine if an unloader 1 brace would decrease the disability and help patients maintain an active lifestyle. We wanted to address the patient's perspective, and I think sometimes the researchers try to address their own perspective and not so much the patient's perspective. But this was designed to be a patient-friendly study and one where we could actually see how it affected their lifestyle. So if the expectations were addressed, were the patients satisfied? That was a question because nobody really knew that. What factors were associated with increased disability prior to brace use? So we had several outcome measures that we used to determine whether this brace treatment was successful. We used a WOMAC score for pain, swelling, and functional subscores, Leishman score for function from 0 to 100, and then a Tegner activity scale. So I think each one of these has a different ability to assess the success of the treatment that was done. So basically the outcome measures, patient's expectations questionnaire, patients were satisfied with patient satisfaction with the outcome, somewhere between 1 and 10, with the 10 being very satisfied, and anti-inflammatory use and what the brace did to either increase or decrease anti-inflammatory use. So the radiographic findings before the brace was applied, we looked at the medial and the lateral side of the knee. And we found that on the medial group, this would be the inner side of the knee, that the general change was about 2.4, the height of the space was about 2.4 millimeters. The average lateral joint space was about 4.2 millimeters. And I think the reason there was a difference is that the arthritis affects more the posterior part of the knee and the lateral joint. So you would not expect to have quite as much of the joint space narrowing. So once again, to measure the amount of malalignment, the percent deviation from a neutral position would be on the medial group, the percent averaged about 26% from the neutral alignment. The neutral alignment would be the center of the knee on that patient. And the lateral group was about 19% off to the lateral side. So our study population, there were 49 patients included, 29 males, 20 females. It was pretty even distribution. There were 34 medial unloader braces and 15 lateral unloader braces. The average age was 62 with a range from 45 to 87. So we didn't rule out anyone. Average BMI, or basically the weight, was about 26, and the range was 20 to 37. They were highly motivated patients because they basically came in for treatment, and they came to a surgeon expecting to get an operation, but we elected to go with this other route. And 5 of the patients did discontinue the brace use. And I think in general, that's a low number for people that are given a brace for treatment of a medial or lateral osteoarthritis. But so I think it does speak well for the brace being tolerated well. At 3 weeks, 27% of the patients, 14, had a decrease in pain medication. 27%, 13, had a decrease in over-the-counter anti-inflammatories. 29%, 14, reported a decrease in prescription anti-inflammatories. So that, I think that's a very good sign as far as the effect of the brace in this early period. At 6 months, 27% reported a decrease in pain medication, 31% reported a decrease in over-the-counter anti-inflammatories, and 35% reported a decrease in prescription anti-inflammatories. So that the only thing that was done to these people was basically the brace, and they were convinced to use the brace, though. If it's on the shelf, it's not helpful. So the results for patients with the lateral unloader 1, the WOMAC at 6 months following brace use was strongly correlated with a deviation from neutral alignment. In other words, the more the angle was to the knee, the correlation of that correlated with the deviation for the medial neutral joint. And what this means is that the less malalignment a patient had, the less disability they experienced with the use of the brace. For patients with a medial unloader 1, pre-base WOMAC, 6 weeks WOMAC and 6 months WOMAC correlated with medial joint space. And what this means is the less knee joint space a patient had, the more disability they experienced. So this is a WOMAC score. It's for pain, stiffness, and function. And in each one of these areas, the pre-brace improved at 3 weeks, 6 weeks, and 6 months. And pain was improved, stiffness was improved, and function was improved by quite a bit. So this was a good confirmation that our patients, number 1, were using the braces, and number 2, that they were having a positive effect. So there was also a significant decrease in disability due to osteoarthritis. And this just shows a look at that number. So the WOMAC total score decreased significantly during this period of brace use. There was also significant improvement in quality of life, and their pain, stiffness, function, and basically the SF-12 is their quality of life. And the quality of life improved significantly while they were using the braces. So the results, the patient activity level, average activity level increased from pre-brace to the final follow-up. The Tegner, as Karen Briggs mentioned earlier, is a measure of brace of function in the brace. And the pre-brace median Tegner was 2, and the final follow-up median Tegner was 3. And it's a big difference, because the Tegner at a level of 2 has no recreational sports in their lifestyle, whereas the Tegner of 3 equals a recreational sport lifestyle. So this was a real significant slide. Patient activity level improved, and it was maintained, improved patient function. And only 2 patients had lower activity level at the conclusion of the study. Median patient satisfaction with outcome following use of the brace was 8 out of 10. So that's a very significant improvement from their preoperative state. So our conclusion was that it met the patient's expectations of general health improvement and decrease in pain and stiffness, that there was a significant decrease in disability in active patients with osteoarthritis. Patients were satisfied with the outcome, and outcomes need to match the patient's expectations for successful treatment. Well, thank you very much.